Hello, my name's Lisa and I'm a radiographer from the Nuclear Medicine Department. For those of you not familiar with us, and I suspect that might be quite a large part of the panel, we're a quiet stalwart of radiology and we live in the basement of the tower block. We provide a wide variety of functional diagnostic tests, and so in essence that means we're looking at how things work rather than just what they look like. Radiology gained its nationally recognised quality standards for imaging accreditation this year, and we were rated outstanding by the CQC. For the most part, we see cancer patients, prostate cancer, breast cancer, some neuroendocrine tumours, but we also have a strong link with cardiology. And it's the patients that we're testing for significant coronary artery disease that I'm here for your help with today. This is a passion project for me. I'm the newest member of the cardiac stressing team, and when John retires next year, looking like this most probably, I would like to be able to continue the fantastic service that he set up in a room that better reflects this. The patients that are referred to us come from a variety of places. So we see patients who are being investigated for chest pain. It might be new chest pain. They may have had interventions on their hearts in the past. We also have referrals from anaesthetics for patients who are high risk for surgery. And we see patients who are hoping to maintain their place on the transplant waiting lists. So as you can imagine, that spans a huge, big population. It might be any one of us that needs this test in the future, or perhaps someone that we know. To start the stressing procedure, the patients are asked to change behind this. Now, I do my best with origami, but trying to make that into a cubicle around a patient in a tight space is really tricky, and it's not particularly dignified. Given the choice between this or a full-length curtain, I know which one I would much prefer. To maintain privacy, the screen is then used to block the glass window in the door, and that actually takes up about a metre of space in the room. The patient has a cannula inserted using an injection trolley that frankly needs retiring more urgently than John does. The test that the patients have looks at the coronary blood flow. So we give them an infusion of a drug over 4 minutes that simulates vigorous exercise. Healthy coronary arteries will open up nice and wide, allowing maximum blood flow. Any arteries that have become narrowed or compromised open to a lesser degree. The additional injection of our radioactive tracer finds its way through those coronary vessels, and then it will fix and stick in the heart muscle where it first arrives. So where we get maximum blood flow, we get maximum amounts of our tracer. This scan then makes a 3D coloured map of the heart, and we're able to see where the blood was able to get to when their coronary arteries were at their widest. Now, the drug infusion comes with side effects, and these can range from quite mild to quite intense. So naturally, we have to monitor the patients very carefully before, during, and after the test. We need room for the blood pressure machine, the ECG machine, the infusion pump. And we also need room to be able to manoeuvre around the patients ourselves. If the blood pressure drops, we have to lie the patients flat, get the legs up really, really quickly, and we need room to be able to do that. In the rare event that the crash team would need to attend, we would be asking a lot of people to make their way into quite a cluttered space. So by maximising the floor space, we're actually more effective and we're more safe. Thank you. The storage in this room covers the floor space rather than using the ceiling height. So my pitch today is for some furniture that would allow us to use the room in a much more effective way. And it would also empower our patients if we were able to provide a curtain track and they could change behind that rather than using this bulky screen. The trust would be in part fulfilling its own brilliant care strategy by providing an excellent patient experience and reducing avoidable harm. My pitch today is for £3,604.50 for a new computer desk, storage cupboard, injection trolley with wheels that work cohesively, some vinyl to obstruct the window, and to replace the bulky screen with a curtain track. The Trust will be meeting its own care pledges, and modernising this room will have a huge impact on patients who deserve more. Thank you very much.
Well Lisa, thank you so much. And you didn't need to tell us it was your passion project, because you know what, that shone through with every single word you said. So thank you so much for doing that for us. Questions? Adam, Kim?
So I might have to say I absolutely agree. I have been down in nuclear medicine recently.
Fantastic.
And know how vulnerable you can feel having to change in a huge room with nowhere to hide. So absolutely did a great pitch, and I can't think of a question because I'm in total agreement.
So no pressure, Adam, but you need to come up with something really gritty now, okay?
Is it just using the room that you already got, or do you need other space?
No, if we were able to replace, so there's a wooden storage cupboard that actually is so inaccessible we can't store much in it. So if we were able to, we can still utilise the space that we've got, but we can just do it in a better way. So rather than using the floor space, if we're able to use the ceiling height, we've got some of those HD storage cupboards, the clear glass ones. If we were able to have a single one of those in the room, that's immediately going to give us more space. A sit-stand desk, again, is going to give us more space. And just getting rid of this and providing a curtain track in the room, again, is just going to open up the room so much more.
Because the estates cost look really low from what I'm used to seeing from estates.
Okay, I got the email to say I'd been shortlisted on the Wednesday, and then I was on holiday on the Monday, so I had to get them to come. They were brilliant, and they came the next day, and I told him exactly what we would need. Okay. So the costs are, I've given the cost of what buying everything is, and then they gave me the cost of fitting the cabinet, removing the old desk, fitting the new cabinet, and putting a curtain track in. The desk they wouldn't have to install because it's a freestanding, and the injection trolley has its own wheels. So it would be simply for removing the desk, installing a new cabinet, and then putting the curtain track up.
Great.
Lisa, Sarah, how many patients do you see a day? How many patients will this give a better experience to?
So we do 3 sessions a week, a Monday, Tuesday and Thursday. We do probably 7 or 8 patients on each of those days. So 24 patients a week.
Great. Lisa, thank you so much for doing that. Well done.
Thank you.
How was your pitch to the RCHT Day?
Oh, it's fantastic. They were much friendlier than I kind of had in my own head that they would be. And yeah, they asked lots of good questions at the end. So yeah, I thought it went well.
Yeah. Did you get any feedback from them when you were in there?
Yes, I had some feedback that Kim had been down to the department before, which I hadn't realised. So she was well aware of where we are and the kind of space that we work in. And there were some lovely comments about how passionate the pitch was.
Fantastic. Well, fingers crossed for you and good luck.
Thank you very much. Thank you.